Good morning, everybody. My name is Rachel Irura. I am the head of the Witness Support and Protection Unit of the UN International Residual Mechanism for Criminal Tribunals, based in Kigali, Rwanda. I am an alumni of the center from 2002. The theme for today, which is the 8th theme, is the impact of UN agencies on the protection of human rights during the COVID-19 pandemic in Africa. I am joined by 3 panelists, and I will introduce them first, and then I will go through the house rules. Our first panelist is Dr. Patrick Eba, who is an alumni from 2004. He is the country director for UNAIDS in the Central African Republic. He will be presenting on the topic building multi-level partnerships to ensure access to healthcare during the COVID-19 pandemic. Our second panelist is Meskerem Techane, who is an alumni from 2012. She is the chairperson of the UN Working Group of Experts on Discrimination Against Women. She will be focusing on UN special procedures, which is part of her mandate, as the approach of the UN Working Group of Experts is limited to what human rights bodies can do. She will also speak about the protection of women's rights during this pandemic, however, focusing on what the UN Working Group of Experts does. Our third panelist is Kene Esom, who is an alumni from 2006. He's a policy specialist in human rights, law and gender with the United Nations Development Program. He will be speaking on the topic leveraging rights aspects, using and use of data during the COVID-19 pandemic. I will quickly go through the house rules. Welcome to all of you, our participants, alumni and the public. Each speaker will be allotted a time of 10 minutes for their submission, and the webinar is hosted by the center, but made possible by its alumni. It's now open for the public to benefit from. Speakers and participants are requested to mute their mics and videos when they are not speaking. We are all trying to take advantage of the bandwidth that we have, and therefore, if you have your video on, it limits that for some of us. I would like to also introduce a poll that is being held by the center. You can participate in the poll. It will pop up on your screens, and you're able to choose the most relevant option. It has now popped up, actually. So you're able to choose what drew you towards today's COVID-19 discussion forum on the impact of UN agencies on the protection of human rights during the COVID-19 pandemic in Africa. You can choose what applies. I'm also doing that now. And you can submit. So after that, I will just highlight briefly for you what is happening where I am, which is Kigali in Rwanda. I will start by speaking about the measures that have been taken by the government of Rwanda to try and limit the COVID-19 pandemic here in particular. We actually had quite a serious lockdown for at least 2 months, where all borders and commercial flights were closed. They're still closed from 15th March 2020 to date, when the first COVID-19 case was discovered in the country. And everyone who is a returning legal resident or Rwandan national is subject to a 14-day mandatory quarantine at their own cost. Initially, it was at the government's expense. Some of the measures the government took were the use of drones to spread the COVID-19 message. The lockdown, as I said, was quite impactful because you had to have a police pass to move about. To mitigate this, the government of Rwanda had handouts to marginalized groups to ensure that no one was really stranded. Although it has had a huge economic impact, of course, on people because they couldn't go about their daily businesses as they usually would. They couldn't work, and they couldn't make their daily incomes. And yes, so The UN in Rwanda continues to support government efforts in fighting the COVID-19 pandemic, and it supports the health emergency team, the scientific advisory group, and the assessment of the socio-economic impacts, economic recovery plan, in addition to mobilizing funds. So some of the measures that the UN country team here has taken, and I do see it on the UN country team meetings, is we have a regular virtual town hall meeting every Monday for all UN staff under the auspices of One UN Rwanda. It is facilitated by the UN resident coordinator to ensure that all staff are kept apprised of what's happening, because when you're in your home, you'll feel a bit isolated, especially if you're away from your family and you have no idea what's happening. So they keep them involved about all the measures that are taken by the government and by the United Nations. I must state that the UN has been working remotely for the last 3 months with only essential staff in line with the government measures imposed by the government of Rwanda. And some of the things they've also taken in an innovative way is individual contributions by UN staff members to support the government of Rwanda. All UN staff members who, to be honest, are in a more privileged position than most of the staff, local staff, or persons working in other fields here, who are called upon to give a voluntary contribution to the government. And we raised quite a huge amount, which we handed over to the government to help people who are suffering the consequences of the COVID-19 situation due to a limitation of their finances or their ability to work. On a UN level, we've had a joint ordering of personal protective equipment such as hand sanitizers and masks for all the UN agencies to ensure that these are able to be sourced. The World Health Organization has been providing infrared thermometers to be able to check temperatures without going near persons. And UNICEF and WHO have organized virtual trainings for security staff and cleaners at a lot of the organizations, UN agencies, as well as local organizations. In terms of the UN, the International Organization of Migration has offered their clinic as a support system so that any UN staff member who needs to be isolated can be taken there. In terms of the country, UNDP, and I note that one of our speakers is from UNDP, donated 5 high-tech robots to minimize the exposure of frontline health workers. The robots can perform several tasks such as taking mass temperature screening, delivering food and medication to patients, capturing data and detecting people who are not wearing masks, among others. I work for the UN-IRMCT. I am the head of the Witness Support and Protection Unit. When Kigali was closed off, the actual impact is a lot of our witnesses who come here to the clinic that we run, a witness support section clinic, fully with a doctor, with nurses, and where our most vulnerable witnesses who have pre-existing health conditions can get food and medication could not come. So we have been conducting outreach to various parts of the country to be able to make sure that our witnesses are taken care of. So this is what Rwanda and the UN in Rwanda and the UN-IRMCT have done. I will now open the floor and invite our first speaker, Dr. Patrick Eba, to please take the floor. I will reiterate, he's speaking on building multi-level partnerships to ensure access to healthcare during the COVID-19 pandemic. He is the country director for UNAIDS in the Central African Republic. Please welcome Dr. Eba.
Thank you very much, Rachel, for inviting me to speak. And hi to everyone who is connected. Thank you to the Center for Human Rights for organizing this event. It is really great to join colleagues and friends for this conversation. And I want to start by saying that I was a person who was infected and cured from COVID-19 just a couple of days ago. I was able to experience in my own body the physical impact of the disease. as well as the anxiety that it causes for those who are affected and their family in a global context of uncertainty with treatment. From my own perspective, I can say that COVID-19 is far more serious than just a cold for the hundreds of thousands of people around the world who develop the moderate or severe symptoms related to the epidemic. I think it's important to reiterate these basic points from the onset because we are in a global and continental context of fake news and distrust that are contributing to undermine the efforts to respond to this pandemic. So COVID-19 is real. It's affecting people across the continent, and many of us in our families and personally have been affected by this pandemic. I've been asked to speak about the contribution and impact of the UN agencies from the perspective of partnerships. I want to do that, but at the same time, I also want to highlight what to me is more important, which is how the UN contributes to human rights in the response to COVID-19. So I will be speaking both from the perspective of partnership for realizing access to commodities in the context of this pandemic, but also speaking about the role of UN agencies from the perspective of human rights in this pandemic, and speaking more specifically from the perspective of UNAIDS, which is the organization that I serve. And I will be doing so looking both at the global contribution of UNAIDS in this response to COVID-19, and then I will share specific perspective from the Central African Republic, which is the country where I work, and I will be highlighting some of the contribution that UNAIDS makes in the response to COVID-19 in this country. As you all know, the contribution of UN agencies and the impact first depends on the mandate and the areas of focus of those UN agencies. As you know, WHO has a mandate that is focused on health, and as a result, this organization is the global leader in the overall response to COVID-19. The Office of the High Commissioner for Human Rights focuses on human rights norms and principles and practices, and as such, their engagement and the perspective, the entry point into this COVID-19 pandemic is that of a human rights lens and supporting countries to ensure that they implement a response that is in line with human rights standards, principles, and norms. And the same can also be said of the UN Secretariat, which is the overall UN body, which actually coordinates and leads the engagement more generally with member states on the need for a truly global response that leaves no one behind. You've all heard the UN Secretary General speak very powerfully around the epidemic and the need for global solidarity. And he said something that I believe is very important and speaks to the reality that we all live in a number of African countries. He said that in the global response to COVID-19, the world is as strong as its weakest link, meaning that if we do not pay attention to the situation of the most vulnerable and most fragile countries, the global response will not work. And this statement speaks so true to the reality here in the Central African Republic, and I will be speaking to that very shortly. So starting on the role of UNAIDS and our engagement in the COVID-19 pandemic globally, and more specifically in Africa, I will start by saying that UNAIDS is an advocacy and a policy institution that has used its role to support advocacy efforts in the COVID-19 response globally. And UNAIDS has also tried to highlight the potential linkages between COVID-19 and HIV. Very early in the COVID-19 pandemic response, UNAIDS recognized that some of the
Dr.
from
Eba, we
HIV
seem to be
in
losing
terms
you.
of human rights-based approaches could be very pertinent, 19. And this contribution by calling for a coordinated commodities. Okay, can you hear me now? Hello, can you hear me now?
We can all hear you, yes, thank you.
Okay,
we lost
great.
you there for a moment.
Okay, sorry, bear with me, you know, internet connection and IT is very challenging in this context where I work. So I was saying that the first aspect of UNAIDS contribution really speaks to the topic of this talk, which is the partnership for ensuring access to services and commodities. And from that perspective, UNAIDS was very early engaged in efforts to support a coordinated access to health commodities and medicine in the context of COVID-19. And we did so by joining world leaders, head of states, ministers, and other leaders of global and regional institutions for an open letter that was titled United Behind the People's Vaccine Against COVID-19. This open letter called on the World Health Assembly to adopt a resolution in favor of equitable access to health commodities to address COVID-19. Several African leaders joined this call, including the President of South Africa, the President of Ghana, Senegal, and the Chairperson of the African Union. And this call was about pushing for world leaders at the 73rd World Health Assembly to adopt a resolution that ensures access to commodities, diagnostic treatment, and access to a vaccine when it's available for all. And this resolution was indeed adopted during the 73rd World Health Assembly. And it's really a breakthrough, although there are still questions around issues of patent and free access for all. This resolution by the World Health Assembly paves the way for a stronger collaboration for responding to the COVID-19 pandemic. And UNAIDS has also been engaged in calling for a concerted action to put together funding to support research and development to address COVID-19. And as you all know, so far, more than $10 billion have been raised for research and development, for treatment, and for a vaccine on COVID-19. As you know, in relation to vaccine, the key challenge is whether the poorest countries and the populations without the means will be able to access an eventual safe and effective vaccine. And through this World Health Assembly resolution, this WHO resolution, and through the efforts, the concerted global efforts that the UN overall is supporting, and that when a safe and effective vaccine becomes available, there will be avenues for ensuring access for those in the global south. And to a large extent, these debates around access to vaccine, to health commodities, and to diagnostic very much reminds us of some of the struggles that we've seen at the time in the early years of the AIDS pandemic around access to commodities treatment for people living with HIV. A second area where UNAIDS is engaged is around the development of global policy in relation to human rights in the context of COVID-19. Already in March, UNAIDS published a comprehensive analysis on COVID-19 and human rights, which was titled Right in the Time of COVID-19, Lessons from HIV for an Effective Community-led Response. This guidance builds on UNAIDS' 40 years of experience on HIV, and it highlights key principles that should guide an effective response to COVID-19. And these key principles include addressing stigma and discrimination, putting communities at the center of the response, guaranteeing the right to access to health commodities, including testing and treatment for all, but also addressing the needs of those who are most vulnerable, including prisoners. The guidance also highlights the importance of ensuring that lockdowns and other restrictive measures comply with human rights principles of proportionality and reasonableness. I want to emphasize on this particular issue of lockdown and restrictive measures. This is an issue that has been of concern to the UN and many other human rights activists across the world, and especially on seeing that in a number of countries, lockdowns, beatings, and acts that can be tantamount to inhumane and degrading treatment in a number of countries. And we've seen people who are locked down being deprived of food, and really serious issues articulate some of the principles that should be observed in the implementation of lockdown and other restrictive measures. And lastly, this guidance also highlights the importance of avoiding the criminal law as a response to COVID-19. We've seen that in a number of countries, the criminal law is being used as a response towards those who are considered to put others at risk, or those who are considered not to apply the public health measures in the context of COVID-19. And we are very concerned because it is an important mean to addressing COVID-19. So this guidance note is available in different languages, French, English, and Arabic. It's been disseminated and is being used by UNAIDS country offices across the world to guide government responses to the pandemic. I also want to note that still on the human rights principles and norms, on 13th of May, UNAIDS together with UNODC, the World Health Organization, but also the Office of the High Commissioner for Human Rights, issued a joint statement on COVID-19 in prisons and other closed settings. This joint statement calls for urgent attention to the vulnerabilities and challenges of COVID-19 in prisons. This joint statement highlights 4 areas where government must act swiftly. The first area is that we call on government to reduce overcrowding. The second area is a call on government to ensure health, safety, and human dignity in prisons. The third area is to ensure the continuity of other health services in prisons, because as we know, HIV, TB, and hepatitis are key health challenges. Concern that some of those programs that are critical to the health of prisoners may be delayed or may be undermined. Because that are used to address COVID-19, including in prisons. The last area and the last call that we make in relation to observe peculiar and very challenging circumstances to ensure that countries continue to observe the Mandela rules on the minimum standards for the treatment of prisoners. And so in addition to these guidance related to human rights that UNAIDS is involved with, we also recognize that COVID-19 has the potential to disrupt HIV programs across the world. And we are very concerned about the impact of COVID-19 on the HIV response in Sub-Saharan Africa. As you know, Sub-Saharan Africa is the part of the world that bears the brunt of the HIV pandemic. And we are concerned that in the context of COVID-19, some of the progress and some of the gains that have been made in this sub-region in the response to HIV may be undermined. And as a result, UNAIDS released, together with the World Health Organization, we released a modeling study that shows that a disruption of antiretroviral treatment for more than 6 months could lead to over 500,000 extra deaths from AIDS-related illnesses in Sub-Saharan African countries this year and next year. We also estimate that about 104% new infection may occur among children if we do not address effectively the impact of HIV in Sub-Saharan Africa in the context of COVID-19. So we are very concerned about the impact of COVID-19 on the response to HIV, especially in those Sub-Saharan African countries. And we are particularly concerned about the situation of countries in Eastern and Southern Africa, which is the part of the world that is mostly affected by the HIV pandemic. And so this is really from the perspective of the global response. UNAIDS engages in relation to access to commodities for COVID-19. We engage in human rights and provide guidance more broadly on human rights and COVID-19. And we also engage in relation to ensuring that in this peculiar context, countries remain focused on the response to HIV because we fear that the gains and the progress may be undermined. So this is the engagement at global and
Dr. Eba, we seem to have lost you. Can you hear us? We appear to have lost Dr. Eba. Can you hear us? We appear to have lost Dr. Eba. We may return to his presentation later, but I think I will interject and just recap that we had Dr. Patrick Eba, the country director for UNAIDS in the Central Africa.
Can you still hear me?
Now you're back, yes. Now we can hear you.
Okay. Yeah, so sorry about that. As I said earlier, the internet is very challenging here. So I was concluding on the overall engagement by UNAIDS at global and regional level. But then now I wanted to very briefly speak about some of the work that we are doing at country level and sharing the experience from the Central African Republic where I work. As a quick background, the Central African Republic is a country that has been faced over the past decade, has been faced with protracted conflict that has led to the deterioration of its health system. The country has less than 4,000 qualified healthcare workers for a population of 5 million. We have one of the highest level of maternal and child mortality in the world. Less than 50% of people with HIV and TB have access to treatment. So this is the overall background in the country. We are also faced with the third most serious humanitarian crisis in the world after Yemen and Syria. So this is a country with very challenging humanitarian, health, and social context. And COVID-19 comes against this background. And access to health commodities in this country is generally very challenging. As I speak, we have about 2,000 people who have been infected with COVID-19. We have about 5 deaths overall. Initially, the response to COVID-19 in this country was a very measured one. The country did not adopt any form of quarantine or lockdowns of its population. To the contrary, it applied a very progressive and measured response with testing, isolation, and treatment for those who were positive to COVID-19. But the main challenge that we are faced with in this country is that we have very limited numbers of tests. As I speak, we have less than 2,000 tests for COVID-19 left in the whole country. And we fear that if we do not have supply soon for testing, our response will come to a standstill. In terms of treatment and in terms of personal protective equipment, the country is also confronted with serious challenges. And it is in this context that the UN comes in and tries to support a number of aspects of the national response. WHO, UNICEF, the MINUSCA, which is the UN peacekeeping operation, and other UN entities are involved in directly supporting the national response to COVID-19 by providing financial, technical, and material support.
Dr. Eba, if I may interject, I think we will wrap up because we'd like to move to our next speaker, and I see we've lost you again. At this juncture, I would like to recap what Dr. Eba spoke about, and the main thing that came across from his presentation is actually a very personal one, because he was affected by COVID-19 and recovered. So he actually experienced the pandemic or the virus in its real sense. He also spoke about the global contribution of UNAIDS in terms of support to funding, access to health and development, trying to I mean, the vaccine is not yet at hand, but the development of that is underway globally. There are tests going on. He had a concern in relation to the criminal response to COVID-19, you know, lockdowns, for example, and the violation of human rights. One of the things that came out of his presentation is that the lack of access to antiretrovirals is a huge problem and could lead to an excess of over 500,000 deaths as a result of the pandemic. And he then spoke about the response in the Central African Republic, which has been very measured. There have been no quarantines or lockdowns, but it's, the limited testing kits have posed a huge problem. I will now invite our second speaker. Just to recap, we are now at our second speaker. She's Meskerem Techane, the chairperson of the UN Working Group of Experts on Discrimination Against Women, and she'll be focusing on UN special procedures, which is part of her mandate, and the approach of the UN Working Group of Experts in relation to the COVID-19 pandemic. We will have room for questions later, where at the end of the session, whereby you can either type your questions in the chat box, or you can raise your hand and take the floor. If you do that, we'll ask you to please have your video on and your microphone so that we can hear you. Please, Meskerem, kindly take the floor. Thank you.
Hello, everyone. It's a great pleasure to be part of this alumni conversation. Thank you, Rachel, for moderating your excellent moderation so far. And I would like also to thank the Center and the Alumni Association for organizing this important conversation. The working group, which I'm a member of, is part of the UN special procedures, or what we know as special rapporteur mechanisms under the UN Human Rights Council. From the name of the working group, as you can see, the thematic focus is on discrimination against women and girls. So we cover a range of human rights issues, discrimination being a very wide human rights issue. We cover from economic, social, cultural rights to civil and political rights, and also women and girls being a diverse group. We cover all groups of women based on age, disability, migration status, and all that. We closely work with the larger body of special rapporteurs under the Human Rights Council, the treaty bodies, and other human rights mechanisms at the UN and regional level, in order to deliver on our very broad mandate. So the working group is a 5-member expert group mechanism from the different regions. Actually, my term as chair just ended this month, so from now on I'll be a former chair. Just to say a bit about, to distinguish our role from UN agencies as human rights mechanisms, our mandate focused on human rights monitoring or reviewing, also some standard setting, and a lot of constructive dialogues with UN member states. And we do this through thematic reports that we issue annually, country visits, and communication procedures, and also at times consultations. So unlike UN agencies, as you can imagine, as human rights mechanisms, our interventions are limited to engaging at policy level. We don't have services, programs, or implementations on the ground. But so far, in the context of COVID, within the limits of our mandates, we have been calling for a human rights approach to the COVID-19 response. So I will highlight what we have observed as prominent women's rights issues, mainly from an equality and discrimination point of view that came under our mandate in the working group, and also what the working group and the larger body of special procedures have been doing to engage with member states and other stakeholders. So the working group has been documenting and analyzing and amplifying issues that concern women and girls, mainly from equality and discrimination perspective. And 3 main issues that came out are the particular risk and exposure, burden, and the particular risk, exposure, and burdens that women are disproportionately sharing in the context of the COVID, and also the marginalization of women's voices, and also the marginalization of women from leadership positions. Generally, what we have noted from our analysis is the exacerbation of pre-existing inequalities that women have been already facing. To highlight on leadership, for example, women from diverse groups and backgrounds have not been included in all levels of decision-making concerning the pandemic. Of course, we have seen in some states very good practices where women have been leading the fight against the pandemic, and that rendered very good results. But the overall global trend is the continuation of marginalization of women from leadership and decision-making in these important issues that concerns their life. Then a particular exposure that women are facing generally as a group is because most women are on the front line of fighting the pandemic. They are frontline workers, be it in the medical field or also other services. So they have this particular exposure to the pandemic itself. And another is the specific risk that some group of women are facing because of their age, maybe children, girls, because of their disability, because of their gender, some because of their ethnic origin, others because of their migrant status or urban and rural location. So the women being diverse groups, they also are bearing the burden of this specific risk based on their different identities and background. Another major issue that came out is the denial of health services that are essential to women and girls. In the context of the COVID pandemic, priorities being shifted to other health interventions. A lot of sexual and reproductive health services have been suspended as non-essential, and this has caused denial of very important health services for women, sometimes that are even urgent as a matter of life-saving. Violence against women or gender-based violence is also noted to have a dramatic increase in many countries. From the several allegations that we have received, the reports that we have looked at, there has been a significant increase of gender-based violence, and in particular, domestic violence. So the problem is not only the increasing incidences, but also the lack of services in the context of COVID, because many services have been shut down. So women who are suffering from violence or have not been accessing legal services, medical services, social services, and so on. And again, this leads me also to the issue of access to justice. Generally, access to justice has been very limited in the context of the pandemic. And as I've said earlier, women being the frontline workers, and some of the issues that they are facing that should be a subject of legal issue have not been dealt by courts, because courts are not operating in many countries. Many labor issues, eviction issues, women have been evicted from their houses because of their exposure to the pandemic, because of the nature of the work they do. For example, medical workers, nurses, they have been evicted from their houses. And some have been also their labor contract has been terminated in the context of the COVID, but they could not take all these issues to courts. And some urgent issues such as child maintenance, child custody, all have not been taken before court. So a lot of access to justice issue has come out in the context of COVID. The burden, the disproportionate burden of care work is another issue. We know that women have already been sharing the disproportionate burden of care, in particular household care responsibility, and this has increased significantly due to the closure of schools and care facilities because of the pandemic. And this has, again, of course, led to the affecting their physical and mental health. Economic burden is also another burden that has been disproportionately shared by women. Women being, significantly represented in informal, poor paid work with lack of social protection. The lockdown, the partial or full lockdowns that have been introduced to fight the pandemic have also caused loss of their job, loss of income, loss of livelihood, and this has resulted in a huge amount of economic burden for women. So this has been documented by the working group, and not only documented, but we have been issuing a call for states to address these issues from a human rights perspective. While it's important to take different measures to fight the pandemic, it's also important to understand, recognize, and integrate these issues as part of the fight against the pandemic. Coming to, as I said, our mandate is very broad, covering different thematic issues and countries, and also different groups of women. We closely work with the larger body of special rapporteurs. So we operate as a body of special mechanisms. That means women and girls issues are part of almost every thematic and country rapporteur mandates. And we have been jointly working with the different rapporteurs to cover these wide-ranging issues. We have been working jointly more than ever, and generally coming to the joint work of special procedures from the system, various measures or interventions or initiatives have been introduced in relation to the COVID. And the main objective or the central theme of these all initiatives have been emphasizing the importance of a human rights approach in addressing the crisis. So this message has been calling upon states, also calling upon UN agencies and other stakeholders who are all engaged in the fight against the pandemic. In this regard, special procedures have issued various recommendations to states and other stakeholders through the various public actions that we do. One type of intervention or public action was the issuance of guidance tools, different forms of guidance tools in the form of guidelines, dispatches, and other reference tools have been issued, building on human rights standards and highlighting key principles and measures that are relevant in the context. For example, guidance tools on homelessness, protection of informal settlers, and protection from eviction has been issued. Also, a guidance note on freedom of assembly, highlighting key principles for ensuring the right to freedom of assembly in the context of the COVID. Also on the issue of disability considerations that are very important under the situation. Again, recognizing the issue of access to justice, a guidance note on how to keep the judiciary functioning under this restricted situation has been also highlighted. Another very important contribution is the use of force by law enforcement. As we know, there have been different emergency measures introduced by several states globally, and that has caused also, in as much as it was helpful to fight the pandemic, that has also caused a lot of violation of human rights by excessive use of force, and this guidance note is introduced in order to guide states in the measures they take. Public statements in the form of press releases, open letters have been also issued on different thematic issues, and these are so many that have been issued jointly by many rapporteurs or separately by different rapporteurs, but there are so many. But the purpose is again documenting, analyzing, and amplifying the prominent issues and calling for a human rights-based approach to public health issues and to emergency issues. One important methodology of the special procedures is the communication procedure, which is unlike treaty bodies, it's a bit of a confidential engagement with member states. And some are, of course, public because we have issued press release on them. Some are not public because we are still engaging confidentially with member states. But so many, or close to 30 communication complaints have been received by special procedure mandates since the COVID pandemic, and we have been addressing diverse thematic issues and countries under this procedure. And interestingly, this communication procedure also involves not only states. We've been able to engage with non-state actors who are playing key role in the pandemic, as well as in the alleged violation of women's rights and human rights. Another method that we use is reporting to the Human Rights Council, and some mandates also they report to the General Assembly as well. So the use of these thematic reports is also one avenue that special procedures can contribute in calling upon the human rights approach to the pandemic. And so far, I mean, different rapporteurs have different reporting timeline to the Human Rights Council and the General Assembly, but so far, for example, the rapporteur on freedom of expression has issued a report on disease pandemic and freedom of opinion, as we know that there are a lot of issues around freedom of opinion or freedom of expression in relation to the pandemic. We have seen arrests and other form of violations against journalists and against activists who have been vocal in speaking out about state measures in relation to the pandemic. And we expect also other mandates to engage in their report in relation to the pandemic. And as far as our working group is concerned, for example, we have a report upcoming on sexual and reproductive health in crisis situations, and we intend to cover a lot of issues that are already arising and that we have been noticing in relation to sexual and reproductive health in crisis situation. So in the COVID crisis, what sexual and reproductive rights look like, what positive and negative measures have been taken by states will be part of our analysis. And we hope that it will be a great contribution, because we have seen a lot of backlash against sexual and reproductive health rights in the context of COVID, more than ever. Well, I would like also to point to some of the creative ways the special procedures have engaged in relation to amplifying their voices in terms of the emphasis we want to give on the human rights approach to the pandemic. There have been, for example, some video campaigns issued by reporters, a video campaign on access to sanitation, for example, a video campaign by a special rapporteur on health, which focuses on hand washing, but relates to access to sanitation as a measure to prevent the disease. This is actually very important for women, as we noted that women and girls in many parts of the world are living under conditions with poor access to sanitation, clean water. So this emphasizes that the one way to fight the pandemic is to ensure access to sanitation, access to clean water for all, and also for those who have been marginalized. Another is, for example, a video campaign on housing and evictions, which highlights also access to housing in the context of the pandemic. One way of fighting the pandemic is also to ensure a safe house for all, and also to curb measures that are focusing on eviction. A social media campaign has been also issued by the rapporteur on sexual orientation and gender identity. This has also yielded a very important engagement with many stakeholders beyond states, also engaging with all constituencies. Actually, this is very important for our mandate, as we work closely with the SOGI mandate as well, as we cover women from different groups. Well, I would, in the end, I would like to finally conclude by highlighting also a general call that has been issued by special procedures. This has been the most disseminated one, and also that involved all mandate holders as a body of special procedures. And this is anchored on the right to life-saving intervention as a measure to fight the pandemic, which is linked to the right to life, I'm linking the right to health and life-saving interventions as part of the right to life. This is one of the emphasis given, but mainly the special procedures in our collective voice, we also emphasize that the pandemic cannot be solved only with public health and emergency measures. Rather, we called for the ensuring all the other human rights, as highlighted earlier, be it the right to housing, the right to clean water, access to sanitation, access to justice, freedom of expression, all that. So we have been calling that the pandemic cannot be controlled just by focusing on public health and emergency measures, but a focus to all human rights is important. Well, it's hard to assess the impact of all these interventions, but We have been having constructive engagement with the states. We have seen some positive measures taken accordingly, some of the recommendations being taken on board by different states. And of course, it's a collective effort by different human rights mechanisms. It's not only our single input. But another important aspect of all this contribution is also these recommendations, making it to the Human Rights Council and General Assembly resolutions. And by way of this, they also become part of the Charter body's positions on the fight against the pandemic, which we underline is a human rights approach. I want to end here and leave the rest for questions and further discussions. Thank you very much.
Thank you very much, Meskerem. Thank you so much for your contribution. We will take questions at the end. I see quite a few in the chat box. We will address them all at the end of the panelists' presentations. Just to recap where we are at, Meskerem was our second speaker, and she was speaking on she is the chairperson of the UN Working Group of Experts on Discrimination Against Women. Her presentation, just to give just a few very quickly, the highlights were the human rights issues that have arisen from COVID-19 and the human rights approach. For example, the working group has been documenting and amplifying several issues such as risk and exposure, the burdens of women, the marginalization of women's voices, and she also noted that pre-existing inequalities have been exacerbated by the COVID-19 pandemic. Some of the issues she noted have arisen were things like the use of force by state agencies, the increase in gender-based violence, such as domestic violence due to the pandemic, and access to justice issues. She stated that a lot of women are frontline workers, and so this places them specially, exposes them specially. They have a specific risk due to age, disabilities, migrant status, etc. And some of them have been evicted. And also issues of sexual and reproductive health in crisis situations. A few of you have asked about guides, and we shall discuss this at the end of the presentation. I would like now to invite our third and last panelist, Kene Esom, who is an alumni from 2006. He's a policy specialist in human rights, law, and gender, and he works for the United Nations Development Program. He will be making a presentation on leveraging rights, respecting use of data during the COVID-19 pandemic. Please welcome Kenneth.
Hi, thank you very much. Thanks for the invitation, and thanks to the other panelists who have spoken before me. I work with UNDP's HIV Health and Development Practice, where, among other things, I coordinate a new area of work on the use of digital technologies in HIV and health. Patrick works with UNAIDS, and UNDP is one of the co-sponsors of the UN Joint Program on HIV and AIDS, where we coordinate or convene the area of work on addressing human rights, stigma, and discrimination that impede effective HIV responses. So some of the things I will be speaking to will also draw from that work on human rights approaches to addressing disease response, HIV in particular. My reflections today will be on the application of digital technologies in epidemic response, and COVID-19 included. I will also share some of the legal, ethical, and human rights questions that this has raised, and then share some of the work that I'm part of within UNDP to respond to this. I will not attempt in any way to try and present a comprehensive or anything near a comprehensive overview of even the work at UNDP, much less other UN entities who, through their varying mandates and work across regions and countries, are also speaking to these issues in their own ways. So UNDP works with governments in across 170 countries and territories to advance the achievement of the Sustainable Development Goals. And working with WHO and other UN entities, we have focused much of our response within this COVID pandemic on supporting countries to prepare for, to respond to, and to recover or plan for recovery from COVID-19 pandemic. And because UNDP works across a broad spectrum of development issues, this support and this work with countries have taken different approaches. But digital technologies, big data has been or have been a part of this support. And as the chair noted, with respect to Rwanda at the beginning of this webinar. So as we know, data is central to advancing health and healthcare, and this is everything from how we discover new disease pathogens to developing vaccines and treatments regimes, to understanding how different populations are impacted by a disease or how people are responding to treatment, all the way to our own abilities as individuals to understand and monitor our health and take more responsibility. I know if we did a poll now on how many of us are using some kind of a digital technology or digital tool to track our fitness, to track our health, to ensure that we're adhering to medications and treatments, I'm sure we will have a large majority of those on this call who are applying digital technologies in one way or the other. The last decade has seen significant advances in the use of digital technology. So everything from computing science to how big data is analyzed, to genomics, to use of biometric information, artificial intelligence to advance health outcomes. And this is collectively often referred to as digital health. And while the benefits are enormous, and I'm not going to even go into that, I mean, we can imagine just how much the ability to apply digital technologies and use data in a very effective way has contributed to positive health outcomes. So these tools have been very beneficial to health responses, but they've also raised certain risks and challenges. I'll speak to this a bit later. But the United Nations, through its agencies and mechanisms, and my colleagues who have spoken earlier have reflected on the ways their various entities or programs or mechanisms are contributing to this. But the UN has been working to understand this rapidly evolving field of digital health, and it is really evolving more rapidly than any of us can follow. So part of the work of the UN is understanding this field and providing guidance to UN member states on how to apply these technologies, not just for health, but across the number of development issues. Just in the last couple of years, the United Nations Secretary General constituted a high-level panel on digital cooperation, which submitted its report last year. And it noted very clearly in that report that universal human rights should guide digital technologies and their applications. In the last year also, the World Health Organization has released the draft global strategy on digital health covering 2020 to 2024. And the aim here is to support the implementation of appropriate digital technologies towards universal health coverage and the sustainable and the health-related aspects of the SDGs. The Special Rapporteur on the right to privacy finalized and presented his recommendations on the protection and use of health-related data to the UN General Assembly. And the Global Commission on HIV and the Law published a supplement to its earlier report, which highlighted, among other things, the opportunities that digital technologies use of big data present for advancing agency protection of populations affected by HIV, but it also noted that there are specific risks that states should be aware of and steps need to be taken to address these. So what are some of these risks and challenges? What are some of these legal, human rights, and ethical issues that are raised by the use of digital technologies? And I'll just pose them as questions. We won't have enough time to even begin to unpack them. But concerns such as privacy protection, who is collecting this data? Who is storing them? Where is it being stored? How is it being used? Who has access to it? Who are they sharing it with? And who are they selling them to? So if you just look up the news in the last year or two, there have been all kinds of exposés on how some of the companies who collect data from the apps we use, then go on to sell them to third parties who, for marketing purposes, etc. Some of the other questions, what does this mean for the right to privacy and the confidentiality of personal health information? For instance, we know that health data breaches remain a major concern. Year on year, we see more hacks, more data breaches exposing health information of millions of people to the public. And if you live in a context where there is marginalization or stigma, for instance, this could be potentially very dangerous. It could also mean the difference between life and death. We've seen this with leaking of information on people's HIV status. In the US 2 years ago, a medical service providers database was hacked, and about 7 million information around about 7 million clients was made open, and this included everything from mental health issues to all kinds of other disease ailments. So these can present specific challenges, especially if you're in a context where your health status might intersect with the criminal law. So for instance, we know that in context where sex work is criminalized, for instance, making available that kind of information potentially puts sex workers at risk. We've seen examples in the UK and in the US where immigration authorities access the health information of migrants or information from doctors on migrants and where they are, and use this to deport them. So there are real human rights questions raised by this. And then when we turn to artificial intelligence, for instance, who is developing the algorithms? What data is feeding these developments? What gender, racial, and other stereotypes do these replicate? We know now from the application of artificial intelligence softwares, facial recognition softwares, to security and law enforcement, that in the US, for instance, these technologies are very biased against communities of color, against women. We've noted also that the demographic developing these technologies also embed their biases, implicit biases in the algorithms that power these technologies. And the impact, of course, the implications for health outcomes can be imagined. And there's quite a bit of research and studies out there to demonstrate this. Okay, so this is dealing with the technologies and how they can be misused, but there are also broader questions about access to these technologies. In the context of COVID, a lot has been made of contact tracing apps and their potential to help us more quickly identify people who might have been exposed and get them quickly into self-isolation or treatment, as the case may be. But in many contexts, access to the internet, to electricity, even to the kind of smartphones or hardwares that make these technologies accessible is still a distant dream. We're speaking from the context of Africa. Luckily, we have been spared the worst brunt of COVID-19. But if, and we hope it doesn't happen, but if the continent has to deal with rising infections and choose to resort to digital technologies of these sorts, you can imagine who will be left behind and who will be marginalized despite the best efforts to even make these technologies rights respected. And then, of course, we talk about what these mean for lower middle income countries where there are limited regulatory framework to take optimal advantage of these technologies and their benefits. We're asking questions about whether these would deepen inequalities within countries, as I've already alluded to, and across countries. And these questions are some of the things that the UN is grappling with together with member states and a number of stakeholders, especially as we see an explosion of interest in the adoption of digital technologies for the COVID response. Now, through various entities, the UN is doing what it does best, developing guidance, working with governments on how their COVID-19 responses roll out and how the role that data and the right kind of data plays in this. WHO just recently published an interim guidance on ethical considerations for the use of digital proximity tracking technologies, which highlights key principles. Ethical principles are embedded in human rights, most of them. But specifically, I would share what UNDP and some of the work I'm involved in is also contributing to this work. So we developed a guidance document for our country offices on privacy, data protection, and the broader human rights dimensions of the use of digital technologies to cover COVID-19, to combat COVID-19. Within it, we highlight key principles. We raise some of the human rights challenges that have come up from both the work we've done and the studies and work of other entities, both within the UN and outside. And this tool is supposed to guide countries in the 117 countries and territories where we have a presence as they work with countries around this. We're also working with stakeholders in civil society and academia to ensure that not just the discourse around the application of digital technologies to COVID-19 response, but the research that is driving everything from the robotics and things like the use of robots to development of technologies, vaccines, etc. Development of apps and tools are rights respecting, and we constantly have different countries coming to talk to us or working with them to think through technologies that they're developing with the private sector around the COVID-19 response. Now, beyond, we also will be hosting an e-discussion, which I hope many of you will be able to join in the coming couple of weeks, looking at the application of digital technologies to healthcare, drawing from the experiences of HIV and the COVID-19 responses. This is leading towards a very specific country guidance on the application of digital technologies to HIV-related programs at country level, where a number of issues have arisen from communities, including the use of the restrictions that use of digital identity documents or the use of biometric data present to effective coverage and access. So this is with respect to digital technologies, big data and those, but also beyond these, we're also monitoring how the information and the data we're gathering specifically on COVID-19 legislations that countries are putting in place, what these mean for human rights, for gender equality, for access to healthcare, for criminalization or overly broad criminalization of populations, for surveillance, for citizen participation. So together with WHO, UNAIDS Secretariat, and Georgetown University, we'll be launching an online database in 3 weeks, which brings together some of the laws we have collected across about 55 countries now, just laws that have been put in place as part of the COVID-19 response. And as we've seen with other infectious disease responses where laws have been used as part of the response, there are a number of challenges, there are a number of human rights issues and direct violations that are embedded in the text of this. So the idea is to make this platform available publicly so that those of us who are concerned about these issues can track what these laws are, but it will also have a crowdsource function so that people can upload text of COVID-19 laws and regulations from their countries. People can be able to do analysis and share them on specific countries, specific regions. So please do look out for this. And finally, just to mention that we are also finalizing a tool right now to undertake legal reviews of COVID-19 legislation. So this tool highlights the key issues in human rights and international law that countries must be aware of as they use legal responses or legislation to further their response to COVID-19 and other infectious diseases outbreak. So we're hopeful that this tool will not just be useful to governments who are currently debating laws, but that where these laws have already been put in place, that stakeholders, including civil society, can use this tool to review these laws and be able to address, work with governments to pull back some of this legislation or to reform these laws and regulations where they exist. So I will stop here. Feel free to reach out to me if you are interested in hearing more of these processes. And I'm hoping that as we roll out some of the public facing aspects of this work, that those of us on this call who are concerned about these issues can bring our expertise and experiences to it. Thank you very much.
Thank you very much for your intervention and thank you very much for your presentation, Kene. We have appreciated it. I will just go through it quickly. Just to recap, Kene Esson was our third speaker, and he was presenting on leveraging rights, respecting the use of data during the COVID-19 pandemic. A lot of his presentation was quite technical, but IT related, but just to give you a few highlights, it focused on the use of digital technology during the pandemic, such as the ability to apply and use data, and especially in regard to digital health. He spoke about a high-level panel report that has been issued by the UN Secretary General and on universal health coverage. And he highlighted some of the issues that are faced during this time in relation to digital technology, in relation to the right of privacy, such as the use of health-related data. You know, some of the challenges that are faced in relation to privacy, protection, storage, access, and selling them. He mentioned something quite important in relation to, in the States, technology has been used against community of color. Technology is biased against communities of color. In fact, there is a question in relation to that, and we will address that shortly. And he also talked about contact tracing apps, which have actually been quite the norm at the moment, and Africa may end up marginalized because we have, of course, it's very evident, lower access to the internet, and as well as we don't have as much access to the internet, and as a result we may be marginalized because technology is not really the norm here. Things like electricity are still a basic issue in some places, and so it may lower it may deepen inequalities for lower to middle class, middle income countries. Having said that, I think we have come to the point whereby we will start addressing the questions. And so I will open the floor up. As to recap the house rules, you can send your question in the chat box, or you can raise your hand if you wish to take the floor. I have a few questions that have already been ongoing in the chat box, and I think we can begin looking at them one by one. The first one actually was in relation to Meskerem's presentation, and the question was whether it's available as a paper. I think I would ask Meskerem to address that. And there are quite a few questions actually which were tabled to her, so I will.
Who stopped you?
if the person speaking should kindly mute their microphone. There are a few questions that were sent to. May I kindly request you to mute your microphone, please? There were quite a few questions that were addressed to Meskerem's presentation. And the first one is whether her presentation is available as a paper. There's also been a general query by a lot of participants in relation to the email addresses of the panelists. That's something I think we can liaise with the panelists, or we can liaise with the center and get the address from maybe the UN, maybe the coordinator for the alumni can provide those. One of the other questions is whether the guidelines are available on the UN platform. And then guidance on access to justice, whether that is available, guidelines on actors in the disability sector, research, and as well as in the children's sector. And then a question also to Meskerem, what role is her institution playing to address discrimination during the pandemic to ensure that women's rights are not violated, and what relief efforts are in place to assist women disproportionately affected by economic inequalities? These are just some of the questions. I think I will allow Meskerem to please answer some of those, and then we will go through the others which have also come in. Please, Meskerem. Meskerem, are you there?
Yes, thank you. Thank you for the questions. Starting from my paper, I don't have the paper in a presentation format. I just organized it as a personal note, but most of the interventions in the form of public statement, guidance note, and also video campaigns, they are all available on UN Special Procedures website, which I can also share with the organizers, and they can share it, but anyone can also go to the UN Special Procedures website. And when you go there, you will also find the different mandates, be it our working group or other working groups, or the thematic and country-specific rapporteurs. So you can also go to the specific page and see what has been issued by rapporteurs independently or also jointly. So most of the things that I've talked about, they are available, including the ones that was asked about access to justice. For example, if you go to the website of the special procedures, and in particular to the rapporteur or independence of judges and lawyers, you will find the one on access to justice. Yes, of course, my email address can be shared, that's fine. In relation to the last question about what role our mandate, I mean, as I've clarified, we are not a UN institution per se. We are part of the UN human rights mechanism. So as a human rights mechanism, our roles are limited to policy level engagement with states and other stakeholders, which means we, as any human rights mechanism, we are engaged in monitoring human rights in implementation in different states. And we do also a bit of standard setting in relation to, for example, these interventions in the form of report, in the form of country visit, in the form of also communications. We do that. And the other is we engage in a constructive dialogue with states. So these are our tools that we use. We don't really provide direct assistance to victims of human rights violations. This is not by nature attributed to any human rights mechanism. That yes, we engage with victims, but our responses are not direct assistance. So what we do in terms of supporting women and also addressing the issue of discrimination against women or a violation of women's rights is, again, urging states by highlighting whether a particular legislation is discriminatory, whether a particular practice or measure is discriminatory in light of human rights standards. So that's what we do. And through our constructive engagements, be it a communication procedure or other, we have the opportunity to discuss, to engage closely with states and provide detailed recommendations or detailed analysis. So this is, I think these were the questions for me. Thank you once again.
Thank you, Meskerem. There was quite a long question. I think you've also sort of addressed that. It was, the question is, prior to the COVID-19 pandemic, the socio-economic, political, and other rights of women in Anglophone Cameroon were already deplorable as a result of the ongoing armed conflict, which the Norwegian Refugee Council presently described as the most neglected conflict in Africa. The COVID-19 pandemic has come and worsened the situation. What can be done to ensure that the rights of women are not violated and that this women seek justice? I think you addressed that in part. I will, and we also addressed the question about what relief efforts have been put in place in terms of highlighting the mandate of your organization, and also the rates and statistics, again, by highlighting. There was a question for Kene, whether it would be possible to access the research relating to bias, please. Whether that would be possible to access. So these are a few questions for Kene, whether it would be possible to access the research relating to bias. And there's also another question, what is the UN stand on software that detects COVID-19 infected people used in smartphones in some countries? I will give Kenneth the space now. Please, if you can address these two questions that have been specifically addressed to you. Thank you.
Hi, so thanks for the questions. I'm happy to, there's quite a number of research. If you did a quick Google, sorry, my son just woke up. So if you did a quick Google search on discrimination bias on technologies, you will find quite a bit of academic material, research in peer-reviewed journals. I think why this is particularly challenging in the context of healthcare is that artificial intelligence algorithms are only as good as the quantum of data that is used to develop them. Now, if you have a situation where marginalized population, and many of us have seen this reflected in our work at country level. So take HIV, for instance. In your country HIV response, which communities are the most marginalized? It's often who we call most at-risk populations, key populations, sex workers, men who have sex with men, transgender populations, people in prison. So because we do not have data on them, our interventions are not made with information that responds very specifically to their needs. And because these interventions are not mindful of data about these populations, the implications of these interventions working for them negatively or non-optimally is very high. So it's the same thing with digital technologies. So if you look at countries where majority of disaggregated data is about a particular population, for instance, or it excludes migrants who for a variety of reasons might not be most willing to have their data out there, and even when they are, the responses are not. So these are some of the challenges that arise in developing softwares, in developing algorithms for artificial intelligence and the tools around it. So this is what these studies highlight, and the fact that we must make sure that for each of these tools, the data that is informing them covers the breadth of populations, demographic subcategories. So it's not enough to say women have been covered, but what categories of women, what subgroups and how have their data been part of that. So happy to share some of the ones that I have, but it's also openly available, especially through a number of civil society actors who are tracking these issues. What was the second question again?
There were two questions for you. Let me just recap the second question. I think it was, what is the
UN softwares? Stand? Yeah, okay. So right now there isn't a stand per se. As I mentioned, WHO just recently put out this guidance to countries on ethical considerations to consider in using contact tracing app. And some of what it does is mention a few key principles and explain them. So the principle of time limitation, the principles of proportionality, data minimization. So some of those questions I raised, what data should be collected? If you're trying to find out who may have been in contact with someone, do you need to use an app that tracks their location? How much access should that app have to all kinds of information? So ensuring that only useful data is collected. Things about use restriction, voluntariness, transparency, and ensuring that privacy preserving data storage tools are used. So if you, I'm happy to share this guidance, and also happy to share some of the other guidance that UN entities have developed to support countries. I think the approach that's been taken with many is to make sure countries know what principles, human rights principles, ethical principles to be considering as these apps are being developed. As I mentioned, especially in the context of COVID-19, the field is evolving very rapidly. And so rather than say this is the app that will work, because even when you find the perfect app, as has been noted, it might not work or be useful in other contexts. The approach is to make sure that developers working with governments and all stakeholders, including the UN, are guided by rights, respect, human rights principles, international human rights standards, and ensure that the principles of legality as entrenched in international law guide these developments.
Kenny, I have two more questions for you, which have just popped up. The first question is, how is the software that is being used to collect data to address COVID-19 addressing data privacy? And the second one is how the software, this is related to that one, to ensure that information doesn't get into the wrong hands. So it's basically how is the software used to collect data to address COVID-19, addressing privacy, to ensure that it doesn't fall into the wrong hands. Thank you.
Yeah, so as I already mentioned, some of these questions the principles I mentioned address some of these. There are two key concerns right now for some of the emerging contact tracing technologies is, do we use, and this putting it very, very simply and in layman's terms, what should power this software? Should we use technologies that are able to locate where people are? So for instance, central to the COVID response is the need to be able to identify who may have come in contact with somebody who is infected. Now, to be able to do it, there are softwares that can track where the proximity of your phone, of smartphones to other phones. So if my smartphone has been close to your smartphone, it's likely that both of us have been in contact. And so they can use those location technologies to say, okay, whoever has been in close proximity to Kene, we need to notify them that they are possibly have been in contact with COVID-19. They must go and test. But giving access to location information on software also opens up the phone and the hardware to all kinds of other information. And there are also inaccuracies. So for instance, we could be in the same building. I could be on the bottom floor of an 80-story building. You could be on the 80th floor of the same building. The location would track us as being in close proximity, even though we are not in physical proximity. So these are some of the things developers are grappling with. Should you use location-based tools? Should you use Bluetooth-enabled technologies, which are less invasive? And even when you use this, what should it be tracking? How should people volunteer to install the software? So we see a number of countries requiring citizens to install COVID-19 software. Some of them encourage, others make it mandatory. Others make it mandatory for immigrants coming into the country or travelers. How much of this violate the rights to informed consent? How much information is being given to people to enable them make those decisions? So these are a variety of concerns that must come to play when any technology is being developed. And some technologies might work for some context more than others. And so making sure that as many stakeholders, and that's part of what we encourage within UNDP, that these conversations are not limited to tech companies and governments, especially when tech companies are driven by profits. So this conversation shouldn't be driven by tech companies and governments. Other stakeholders, UN entities, civil society in particular, should be part of this conversation, raising the right questions. The big challenge we find is that because of lockdown restrictions in many countries, the ability for civil society to organize and respond to government on some of these COVID-19 developments have been severely limited. And so for those of us on the call working together with UN entities, we need to leverage other platforms and tools to make sure that this important function of accountability, of holding government accountable, holding stakeholders accountable to human rights standards and obligation is not lost because of lockdown restrictions.
Thank you for that response. We have another question, but before I move on to that one, I would like to reiterate to the participants that this series of discussions that we are engaging in as alumni from the center and now the public are held every Thursday at 1100 hours South African time or Central European time at the moment. And there will be one on the 18th of June and one on the 25th of June 2020. And before we conclude, we will have a poll. Let us now have the next question, which is for Meskerem. The question is, could you elaborate more on how women are economically affected by COVID-19 lockdowns in Africa? Have there been reported cases of contract termination by employers, and what can be done to support such women? There's also a comment, the cell tower-based location data is not suitable for track and trace, it's too inaccurate. I guess that is for Kenneth. Meskerem, if you could kindly respond to the question. Maybe one of our last ones, but let's see how we go. Thank you, Meskerem.
Thank you, Rachel. Can you repeat the question, please?
The question is, could you elaborate more on how women are economically affected by the COVID-19 lockdowns in Africa? Have there been reported questions of contract termination by employers, and what can be done to support such women? Thank you.
Thank you very much. Yes, it's a very important question, actually. As I've highlighted earlier, one of the prominent issues that we have noted is the economic burden on women. And in particular, in the African context, it's because many women are in informal work or in household agricultural work that are not really regulated by labor laws, and that are not also part of any social security systems, social protection system. Because of partial or full lockdowns or emergency measures that curb freedom of movement, in particular, women lost their jobs or their livelihoods because they cannot engage in this informal work. Most of the informal work actually includes in going out on the street and selling, also going out in the field and working in agriculture. So the measures literally curb this kind of activity, and they cannot do that anymore, which really brings an economic burden on them because they lost their income or their livelihood. And the most disturbing part is also because these women are not benefiting from any social protection mechanism or scheme. In the event of loss of income or loss of job, they don't have any other economic means to turn to. So this is what we have seen. Yes, of course, there have been termination of contracts in several countries in Africa. I mean, some of them in Africa and also in other parts of the world, but naming countries will be, of course, difficult sometimes because we engage in a confidential manner with states. But generally, yes, contracts have been terminated in different countries. We have seen reports. Actually, I don't remember any specific allegation about an African country as part of the communications procedure, but we have noted reports of such termination of contracts. One is because of women's exposure or actual infection by the COVID virus. And the other is also because of businesses being shut down. Some workers are being laid over. There has been so many layoffers. So as part of that, women being represented in low skill jobs or lower levels of work, they are the first to be disadvantaged from such kind of staff layover measures. So this is what we have noted. Thank you.
Thank you, Meskerem. I see I have no more questions in the chat box. So I would at this juncture like to invite you all to participate in a poll, choosing the most relevant options to you. It's quite self-explanatory. The poll has put up now on your screen. So you just maybe select one. I am doing that. Yes. There are actually two questions, and yeah, please, if you can just take that poll before we proceed. I have now done that. I hope all of us have submit a vote on your behalf. So in conclusion, I would like to thank all of you from the alumni from the center. And I see a comment from my esteemed professor, I think it is, France John. It says the only technology suitable for proximity tracing is Bluetooth proximity data. There are a number of ways to keep the data in the device and not share personal data with a central server. Personal data and the protection of privacy only becomes a problem when data is shared. And I think there's another comment before I wrap up. Yes, the center sends a message saying that this recording will be added to this page on the center's website. There's a page there, and a contribution from Kene about the pros and cons of Bluetooth, GPRS location, and cell tower-based technology. And one size does not fit all, and it is important to ensure that human rights and ethical standards are embedded. So on that, I think very positive note, I will reiterate to you that we will have similar sessions. This was theme 8. There will be a theme 9, I think, and a theme 10 on the 18th of June and the 25th of June, 2020. I encourage you all to join at 1100 hours. And the themes and panelists for this forums will be provided in due course. We have been going for quite a while. Thank you for your patience. I would at this juncture like to thank all the alumni and the public who have participated. This has been quite a topical discussion. I would like to thank all the panelists, Dr. Eba, Meskerem, and Kene for your contributions and answering the questions of the panelists. And I'm honored to have been invited to chair this session. Thank you so much. I think at this juncture, we will wind up, and as there are no more questions, it has been great interacting with you all. I see a great session, so I think everyone has enjoyed it. Thank you so much. And I think at this juncture, we are almost at the 2-hour mark, so I think we will conclude. Thank you very much.